Today we're going to be speaking with Dr. Sam Rao, a radiologist. Dr. Rao completed a fellowship in musculoskeletal imaging at the University of Maryland Medical Center. He has been practicing for 16 years and has numerous publications about his research. So, Dr. Rao, thank you so much for sitting down with me. Let's get started with our first question. When and how did you decide that you wanted to go into medicine and then radiology specifically?
So specifically, as far as medicine was concerned, I started thinking about really my third year of college. I was a biochemistry major, and I was actually happened to work in a hospital, and that's how I got my exposure to medicine in general. And I had a
Mhm.
couple. My aunt and uncle also worked in the hospital; they're both physicians, and that's how I got exposed to medicine, and that started thinking about in entering the medical field. As far as radiology is concerned, we didn't really make that decision until I think the end of my third year of medical school, as
Mhm.
I did a radiology rotation, and then I became really interested in it because it had a lot of things that I really enjoyed about medicine and it didn't have the direct patient care aspect, but it had a lot of
Mhm.
technical things about it that I really enjoyed, and so it was sort
Mhm.
of a good mix of things that I wanted to pursue.
Oh, okay. So when you worked in the hospital, did you work there like during college during the summer or?
No, so I actually worked. That was one of my jobs in college. I worked
Mhm.
pretty much every weekend, the weekend
Okay.
evening shifts. So that was what I did for I think like 2.5 years.
Okay.
Yep.
So now that you've gotten pretty far into your career, how strict is your work schedule?
So it's variable. It depends on. We do have a work schedule. So most of the time, we have a set time that we have to be in at work.
Mhm.
Typically, it varies for different radiologists, but for me right now, most of the time it's a 7 to 4, 7 a.m. to 4 p.m. Shift. So
Mhm.
we kind of work shifts, but that's variable. So, I may end up being there till like 5 or 5:30, depending on how much work there is.
Mhm.
And then we also have to do a lot of weekends. So we do
Okay.
work quite a few weekends as well. And then sometimes we also have to cover the evening shifts, depending on,
Mhm.
if somebody who's normally doing the evening shift is out, then we have to all pitch in and cover that. So,
Mhm. So how when you want to take time off, is it easy for you to?
yeah, so for us, the way we work it out is we have a set number of shifts or days that we have to work in a year. And
Mhm.
everything else beyond that is sort of vacation. So we meet as a group. So we're all kind of divided into sections in our practice. Different
Mhm.
practices do it differently. For us, what we do is we basically sit down together and we basically do it like a draft. So
Mm.
everyone has a draft order, and that's based on the number of vacations and holidays that you worked the previous year. So if you worked all
Mhm.
the holidays last year, then this year you will get your pick of your vacation days, and then
Okay.
you just go, you sit down and you go with whichever group you're assigned to, and so it's pretty most of the time it's pretty easy to get the weeks you want off.
Okay, that's good. So what are some interesting things that you like about your job?
So firstly, I mean, it's a very technical part of medicine. So radiology
Mhm.
involves a lot of technical skills or know-how. So we do actually take a physics exam for our radiology board certification, and I actually
Mhm.
enjoy that because I do a lot of MRI and CT scans. So the technical
Mhm.
background is helpful because I was a science major. So that part is very interesting because I use it on a daily basis. Of
Okay.
course, then there's other parts to it where you're reading interesting cases and you're analyzing. So it's almost like I always loved detective stories when I was growing up, and to
Mhm.
me, working in radiology is kind of like because you're looking at clues to try and may come to a diagnosis and to help both the patients and their doctors figure out how to treat that patient in the best way. So that's the other interesting part about it. And of course, then we also still do interact with patients, even though we're radiologists. We do end up
Mhm.
doing a lot of procedures like biopsies and things like that. So you get to also experience a direct patient interaction, and you actually feel like you're making a difference,
Mhm.
in somebody's life by doing that.
Yeah. So talking about interesting cases, what's the stand behind you?
Oh, so the scan behind me is actually a patient that came in. They were trying to get an MRI for this patient of their
Mhm.
brain, but when they were talking to the patient, we do a screening to make
Mhm.
sure that they have no metal in them. And then the patient mentioned that they had been shot
Oh.
many years prior. And usually it's not a major issue unless it's near a vital organ or a vital blood vessel. And this one
Mhm.
happened to be right by one of the carotid arteries going
Oh,
to the
wow.
brain. So obviously, we don't want to put that patient in a magnet because that will, in the MRI machine, which is just basically a big magnet, because that bullet could, fly and go into the blood vessel, and that would be a
Mhm.
catastrophic event.
Oh, wow. Okay. So, aside from that, what are some of the hardest parts about your job?
I think the hardest parts, I mean, there's a couple. One is obviously, looking at images all day on a computer screen
Mhm.
can tire you out, just make your eyes tired.
Yeah.
What's happened over the last several years is we are doing a lot more advanced imaging. So this,
Mhm.
each exam, we're looking at hundreds of images, right? So that can
Wow.
be taxing just from a standpoint of we're looking at a lot of tiny structures and you're looking
Mhm.
at a lot of images. Sometimes some cases have 300 to 400 images that you have to look at, and the problem also is there's a time crunch, so we have to get through those cases in a timely fashion. So you can't spend an hour on each case because there's a lot of patients waiting with scans to
Mhm.
be read. So I think that's probably the hardest, is kind of juggling that. The other part would be is trying to work with all the interruptions. So when we're working, we're constantly interrupted with phone calls or people come in and asking us questions or
Right.
procedures that have to get done. So that would be the other hard part. And I think
Mhm.
the third part would be when you deal with patients, sometimes you're reading, whether it's reading scans or actually doing procedures. Unfortunately, the reality is you're giving patients bad news, that they
Right.
have some condition that's not good, or that their disease, whether it's cancer or whatever the case may be, has progressed and is not responding to treatment. So giving that kind of news to patients is obviously a very hard thing to do.
Yeah, definitely. So, looking back on all those difficulties, what are some things you wish you knew before entering radiology?
Well, from a professional standpoint, I don't think I would have, I don't feel like I should have known anything more. I think I went in with eyes wide open because like I said, I did
Mhm.
a radiology rotation. So I had a good idea of what that entailed. Now, I think the one thing I wish I had done is get a little bit more background into the business side of things, as far as running
Right.
a practice, the billing part, and all those things that we really don't get exposed to when you're going through training and residency, because you're just
Mhm.
so focused on learning radiology and learning all the pathology and how to treat and diagnose things, that you don't really focus on the business side of it. So that's one thing I
Yeah.
wish I knew a little bit more about. And the other
Yeah.
thing is that is kind of a having some level of leadership training, a formal training, because one of the things that I found myself now doing is being a leader
Mhm.
in my hospital. So I'm one of the radiology leadership folks,
Wow.
and so it would be helpful to have some kind of blueprint to go back to and kind of say, okay, that's where I can refer back to. But typically, that's something I wish I had been exposed to more.
Yeah, that makes sense. So, what goals did you have when you decided to pursue radiology, and have you achieved them?
So I think the first goal obviously was to get through the training and be the
Mhm.
best radiologist I could be. And I think I'm happy with what I've achieved. I
Oh,
think
that's good.
at the end of the day, you want to be a conscientious physician, empathetic,
Mhm.
and you want to be able to make a difference, a positive difference in folks' lives. And I think
Yeah.
I do that on a daily basis.
Mhm.
So I think that was kind of my main goal. I think, like the other things, like I said, with the leadership, I did achieve that. Wasn't something that I'd always thought about, but
Mhm.
it's sort of one of those things that kind of fell in my lap when I was a resident. I was asked to be the chief resident for the program, which I
Oh,
did for a year, and then
mhm.
subsequently, I've joined a couple other groups, and I wasn't there long enough to kind of make a difference. But this is a group I've been in the longest, and I've now been asked to take over a leadership position for the last couple of years, so which I really enjoyed as well.
Oh, that's good. How long have you been in this specific group for?
So I
The one that
started
you
here in 2008. So it's been
Okay.
it's yeah.
Hmm. Okay. So so far, did everything go as planned, or have you made some changes in your choices?
So nothing ever goes as planned. One of my goals when I started, when I was looking for jobs, was to be in a group that was small, preferably
Mhm.
less than 20 radiologists, and a group where I wouldn't have to work the night shift, meaning overnights. But as life always throws a curveball at you, I ended up in a group that was at that time it was 50 radiologists, and I
Wow.
ended up actually working the night shift for 7 years, just because it worked out better for me.
Mhm.
It was something that I just adapted to, and so it required obviously a shift in my schedule. I worked 11 p.m. to 7 a.m. And so like I say, it didn't work out like I planned, but it worked out.
Okay, that's good. So what could you have done differently on your journey?
Oh wow. So I mean, there's numerous things. Like I think I alluded to having a little bit more business sided experience. I
Mhm.
also wish I think one of the things about radiology that I didn't quite appreciate as I was when I started looking into going to radiology was how much you have to know about all the other medical specialties, from surgery to medicine to pediatrics, because radiology encompasses all of those. So
Mhm,
I,
right,
I, I wish I had sort of paid more attention to some of the things that just because when you're going through it, you don't realize how much it means, and
right.
so you say, oh well, I just got to get through this rotation, but in
Mhm,
reality, it's all applicable because radiology is kind of, as a radiologist or a pathologist, you're kind of a physician for every other physician. So you kind of have to know a little bit at least about every other specialty. So
mm,
that's certainly a challenge, and I wish I'd known that. I think that would have made me a little bit more, I guess, would have obviously made me better than what I think I am now.
got it. So considering all the constant changes in the medical field with the changes in technology and everything, what are three pieces of advice that you would give to students considering a career in medicine generally or radiology specifically?
So I think, I mean, obviously the one piece of advice is to follow your dreams, right? If you want to be a physician, and you want to be in medicine and help people and change their lives and make a positive difference, I say go for it. I mean, that shouldn't deter you, whether it's because it's a long and arduous journey, that it should not deter you from doing that.
Right.
Secondly, I think you have to be adaptable. I think you have to
Mhm,
keep your mind open, and make sure that you're not discouraged by we're all going to have things that sometimes may not go our way, or it may not go according to plan.
right.
But to be
Mhm,
flexible, to be adaptable, and then also the third piece of advice is always be willing to learn. Medicine is
mm,
one of those fields. Just like in life, you can never stop learning, and I think that's the
that's
beauty of medicine and radiology is specifically is that I learn something new almost every day. There's some new diagnosis or something that's different, and so that keeps it, it keeps it interesting, keeps you challenged, and keeps you always continually wanting to improve.
yeah, that makes sense. Well, that's it. Thank you for talking with me today. I really liked how you talk about your experiences, like when you first started deciding about medicine, and I really hope that your guidance will help many students like myself make some very important decisions in the future. So thank you.